Hey, it's Seth here, and I'm officially 2 weeks post-op with Dr. Nagard in Bellevue, Washington. I wanted to talk about the seriousness of having top surgery and how recovery can be quite laborsome. I honestly didn't spend a whole lot of time thinking about this decision to make top surgery or not. My chest was nothing that I ever really related to, and I just felt, just with just having breast on my chest, it made me not be able to associate my whole body, and I knew that dysphoria was only going to grow the more I got on T, because actually my dysphoria did get more when I got on T. Before I was on T, I didn't bind that much, but then after I got on T, I bound every day, and I knew it would just get worse, and I needed to get it taken care of beforehand. I don't regret the decision, and I don't regret not thinking about this for like a really long time. I felt like the timing was perfect. I felt like everything was perfect. I felt like I had the perfect surgeon, and yeah, I would have even chose her over Garamoni if she was out of. I mean, I liked her so much. If I was out of state, I would have phoned to see her, and she was just a really good surgeon, and I'm really pleased with my results. I like my chest a lot, and but there's the whole reality of what the last couple weeks have been like. I don't feel like I was completely prepared for it, and I want to talk about that, what having top surgery is like and post-op, because it's not like you just go there and you get knocked out and then you wake up and you don't have boobs anymore and you don't have to wear a bind anymore. The reality of it is that I have to wear this bind, which was a lot of guys. A lot of guys have chest compressors. I have to wear this 24/7 for the first 6 weeks. And my wife, she took my bind and she cut it down the middle, and she put a zipper here, and it saved us like $50 because those chest compressors were $50. But before post-op, I was binding probably 4 to 6 hours a day. And so going from 4 to 6 hours a day to being in a bind 24/7, it was a shock on my system, because I wasn't used to being so tightly compressed. The first couple days I had a panic attack, where I just had to get it off, and it was like I couldn't breathe, that kind of panic attack. So that happened like twice, and then after that, my body adjusted to being in this bind. It got used to it. So if any guy is watching this and maybe going through like a panic attack for being compressed for 24 hours, or just know that your body does get used to it. I ended up taking it off. I took it off for an hour that first night, and because it was just really couldn't breathe. When I first looked at my chest, I didn't have this moment where I like identified with it, or felt like it was mine. When I first looked at my chest, it was swollen, it's bruised up, it was like oozing. And I mean, you guys have seen pictures of people post-op one day. It's just gross, and but it's not just the grossness feeling, but it's this feeling of being cut into and just raw right here, and that's just, it's a lot of trauma that your body goes through having your breast removed. I didn't know it was going to be so traumatic, and I'm not saying I regret it, but I just feel like I need to be honest, because I don't think a lot of guys. I've had a couple people on my YouTube asked me if it was really painful. Um, I got my boobs removed. Yeah, it's a little painful. But I just want to stress that the painful part of this whole recovery is not the pain. It's not like extreme pain. That's hard to put to words. Like, well, I'll describe the last couple days for you. Okay, I am 2 weeks post-op, and right now I'm dealing with a lot of swelling. Well, a couple days ago, when I went back to work, I was I felt so bloated. You know, like how you feel like PMSy and you're bloated? It was like 5 times that. Um, just really bloated. I wonder if some of it was. I think I should have kept up more on the Miralax, because the laxative. You guys got to do that. Like when the doctor told me to take laxatives, I'm like, I always poop. No, when you get off of surgery, you get like stopped up. Um, I took Miralax enough where I was pooping a little bit, but then like the last couple days, I was just really bloated. Like felt like 5 times of what like PMS was. Um, and then yeah, it kind of all came out. All that I had built up throughout the last 2 weeks. And my doctor also says that after surgery, there's a lot of gaining of water weight that you lose. Um, that's something that was tough post-op. Um, that's what I'm dealing with right now. And then there's just this. I guess the hardest part would be discomfort and the lack of sleep. Um, I kind of assumed that once I got like got in post-op, that I would be like so drugged up and that I would just be sleeping all the time. That for me that wasn't my experience. I've been getting probably about 8 hours of sleep a night, but it feels like my body needs more than that because it just got cut open. When your body goes through surgery and it gets cut open and all of your energy gets put into right here, into rebuilding and restoring and all of that. Your body is like working and fighting and to recovering. So that's what post-op is. It's at least for definitely the first 6 weeks is just it's recovery, and it's laborsome and it's tiresome, and then you find yourself tired a lot. And so the hardest part of post-op for me has been discomfort, particularly in sleeping, and then the feelings of helplessness. Um, this is really intense the first week, and then it gets better. Um, I realize now, looking back on it, now that I'm 2 weeks out, is that a lot of my helplessness was more not so much my limitations, but my exhaustion, and then the soreness, and then just maybe even the fear of like ripping something. And I lived the first week. I literally felt like I could do nothing. Well, okay, I'm not kind of extreme a little bit. I felt like I could do things, but I felt like Amy needed to help me, and be there for me, especially um, first 4 or 5 days when she took off, and then it was really sad seeing her go to work because, well, she wanted to help me and I wanted her help, and um, I wanted to talk about before I came out as trans. I felt this pressure to uphold this image of being a female, and I felt that pressure my whole life, because what would people say, what would people think, and now that I've transitioned to male, I I don't want to have to hold on to some other type of image. I'll coin the word trans image, in order to please people, or so that people don't think less of me or anything. I see in the YouTube community that, within the FTM, that a lot of guys are not really talking about how hard the first week of post-op is, and how hard recovery is. And I don't know. I mean, I know that everybody's story is different, but I was even talking to one of my local buddies here, and he had a hard time too his first couple of weeks, you know. And well, he's not a couple of weeks yet, but he's been, you know, having a tough time. He was a couple of days behind me. And I know that there's no way that somebody can go through surgery like that and then just pick themselves up and just like, I love my body, I love life, and I don't know, but you just got cut into it, and it's just, I think that really needs to be talked about, because it's not like this easy thing you go and you do, and then you have this man chest. And I don't know, maybe there's people out there that are debating top surgery, and maybe they shouldn't get it, because it's an intense thing, and it's not for everybody. I know that I could have never, so yeah, I'm not going to try to uphold any trans image, or, I want to try to portray transition as honestly as I can through YouTube. Not like I'm going to go and tell you guys everything, though. And that's just the thing when you're watching these YouTube videos, is that guys, they go and they put the parts of life that they want you to see. And there's parts of transition that are tough, that sometimes guys don't share about via YouTube, but they do in close relationships. I remember right before I started testosterone, I had this trans buddy of mine. He texted me late at night, and he was 6 months on testosterone, and he was just having just a breakdown, and feeling like he was never going to be seen as male, and how he felt like a freak, and all that stuff. And if you were to go to his YouTube account, you wouldn't have really known that he was going through such internal turmoil. You know, now he looks hot with his. He had top surgery last year, and I don't know if this year, but he maybe, I don't know, whatever. But there's so much more behind the scenes that sometimes isn't portrayed. And so I'm trying to be completely honest about my experience with post-op, with chest surgery, and I would say that my first week was hell. I didn't look at my chest and feel like I loved it. I will say that every single day has gotten better, and 2 days ago I took my binder off, and because my surgeon been talking about the need to have it off for a couple hours a day, and then to touch my chest, because my initial reaction is to don't touch it, cover it up, and all that. But your body recovers through this far in transit in top surgery. Your body recovers through touch, different kinds of touch, whether it be the shower, or your towel, or your partner touching your chest or me touching my chest, because then it starts to reassociate, because all these nerves were like cut out, and so like it's recovering, it's relearning itself, it's re-seeing itself as a part of my body. And so I took my bind off and spent some time touching it, and looked in the mirror, and it wasn't like I looked in it and I'm like, I definitely identify with it yet. I'm just being completely honest. But I looked at it and I liked it, which was a lot different than a week ago, which I looked at it, didn't identify with it, and didn't like it. But my doctor said, who has been a boob surgeon for 20 years, that there's been research done on people who undergo surgery for body image, and it takes them 3 months until they can identify with the changes in their body. But it takes transgender clients less than that, less than 3 months. I think that your mind, your body is relearning the change. Which definitely, when she was saying that, I was thinking, well, I've never ever identified with my body. I mean, right here, and I don't know what that means, you know. So at least now I was looking at it and liking it, so that's a change. But I know that recovery is just it's a process. And transition really is a process. You know, you don't go get on testosterone and then look in the mirror and be like, oh, I like myself, you know. But every day feels better, you know. So it's like that with chest surgery. It's a process of re-experiencing this life in a new body. Like, you know, so much I want to say. I'm just trying to remember it all. I really want to stress that we're all different people. We all have different recoveries. We all have different transitions, and it's so important that we don't compare ourselves with each other. Whether your story was better than your recovery was better than mine, or your recovery was worse than mine. However it is, you know, we need to just respect that, and just maybe talk about it, you know. I wanted to talk about pain, and I kind of pictured myself maybe being in a little bit of pain for like the first week, and then I would get off like the pain meds and it would go away. This last week there's been swelling, which has been painful, which has been like a different pain than I was in. I don't explain it. But I talked to my doctor about it, and she wasn't surprised, and she prescribed me some more Vicodin. And to think that that's okay. It's okay to reach out and not feel like a big tough guy and like, oh, I'm in no pain and all of that. Just enjoy your recovery. If you need pain meds, get pain meds. I imagine that this swelling's going to continue to go down. I just want to say, you know, that top surgery is a really big decision. Probably going to feel better about my decision the more I go into it. Not that I don't feel bad about it, I definitely feel good about it. But I want to say to all those people out there that maybe are on the fence about top surgery, if there's a way that you could reconcile with your breasts and you feel like they are a part of you, you know, that's cool. Go through it, you know. Something to take into consideration on the fence is that your life's going to be put on hold for 6 weeks after surgery. And I really want you to understand that it's not the easiest thing. It costs money, and then recovery costs time and energy. And I don't regret that. I'm just stating that. There's nothing wrong. If you're genderqueer and you want breasts, there's nothing wrong with that. If you're genderqueer and don't want breasts, that's fine. If you're a trans guy and you want to keep your boobs, nothing wrong with that. There's so many ways to be trans. I I wanted just to throw out there, I had a trans guy tell me that unless I've been diagnosed as gender dysphoric or gender identity disorder or whatever, that I would not be able to get I would not be able to get top surgery. I want to say that that's completely false. I have not been diagnosed with anything since I was like 5 years old when I got diagnosed as ADHD, which I don't have anymore. So I have no diagnosis. My surgeon did not ask me for a diagnosis. She did not ask me for my therapist letter, my therapist number. She didn't care about any of that. She had me sign an informed consent form saying that I'm aware of all of these, and basically their legal butt is covered. When you go into these places, you get this idea that top surgery is a plastic surgery. So when you go and check out these doctors, be aware of that. These are plastic surgery places, and it's kind of like what you want to do with your body is your business, sort of thing. I haven't run across any gatekeeping. I don't think it works like that. I think our minds need to be kind of changed around the whole trans identity, and it's not a disorder. If you're genderqueer out there, okay, so I'm talking to a Pacific YouTuber, you know who you are. If you're female-bodied and you're genderqueer, or you identify as female but you're chest dysphoric, and you want to get your breasts removed, that's cool. You can do that. You don't have to go to a therapist. You can break all gender stereotypes if you want, and there's that freedom out there to do that. And you don't have to go to therapy because there's nothing wrong with you. I'm not sure if there's anything else I want to say. I guess if there is, I'll just, I don't know, make another video. Come here, Toad. Come on. Come on. Come on. Okay, I remembered what I wanted to say. Is that Toad's a lot on the bed now. Ever since I went out and got my stitches taken out and talked with my doctor last time, he's been a lot on the bed. And I want to show you guys a picture of me. It was my first time walking outside our door shirtless, which is quite a crazy experience because, you know, we're having been raised that you keep your shirt on out in public. It was fun. I definitely can get used to the whole running around shirtless, but I felt comfortable enough to go and walk outside shirtless. That was that day I told you about where I was touching my chest. Oh, and I also wanted to say, if you're pre-op trans guy, just start changing the pronouns of your chest. Stop calling it your boobs. I mean, you can do that. Because it's weird, because when you've been calling boobs your whole life and now all of a sudden you have a chest, I find that right now I've been misgendering my chest at times. It's kind of like relearning pronouns and stuff like that. It's like me and Amy both catch ourselves like, oh, not boobs, I mean chest. Oh, oops. And I'm like, I probably should have started calling it differently a while back and not just changed my language to it just because of the way it looks, but more of how I identify with myself, you know? Um, so yeah, and I also want to say for all those trans guys out there that are wanting top surgery and can't afford it or can't, just want to just send out my love to you guys. Um, I didn't pay for top surgery out of pocket. I paid for the anesthesia out of pocket, which is like $1,600, and then the rest of it I put on care credit, which is probably the rest of the surgery is probably about, I don't know, it's a 63 to 6,700, something like that. That was included tax and everything, um, except for I had to buy like the pain meds and all that, all the extras like the pain meds and stuff. Probably a couple hundred. Care credit, I'm on a 4-year plan with 14% interest, and it's probably, the payments are probably going to be about $150 a month or something like that. Just to give you an idea, it's kind of, it seems like it's in the trans community that it's you pay out of pocket for your chest and you have to go and fundraise and all that. If you have good credit and a job where you can afford $150 a month, and you can get this. It's kind of it's less than buying a car. It's kind of less than a car payment if you think of it. My car payment's about $285 a month. It's way less than that. He Toad's liking this. He's a little love bug today, aren't you? All right, that's all I have to say. Yeah, I turned off the camera. They're not listening now. I'm what? I'm full of it? They're listening still? Oh, yeah, you like that. Alright, so check out my picture of me at the end. Probably right now. Or right now, or right. Okay, I'm not actually allowed to lift you yet. You're a little too heavy.